We're going to go over the basic symptoms and some of our evaluation techniques for a TMJ patient. So commonly when somebody comes in, we'll have them they'll come in with complaints of pain down along their cheek. This occurs because a lot of times those muscles are really active during chewing and talking, and you'll get real sore in here. We also will have people coming in with complaints of pain right here, which is right at the joint. And this may feel sharp, it may be localized for the joint, or you may feel ear fullness with that. Also, sometimes people will have pain up here because this muscle is also involved with chewing. It's very typical too for people to have headaches. A lot of times the headaches will occur here, or even start up in the back of the head and go up. When we treat somebody with TMJ, we always treat the neck and upper neck. Most people will have some sort of neck pain or headaches along with jaw pain. So part of our treatment would definitely involve doing some treatments of the neck and checking all of that over too. We also do a lot of educating about posture, as posture is really important for treating jaw pain. So we have some techniques where we will treat inside the mouth to work on this particular muscle. We have some outside techniques. We'll talk to you about your tongue and what position it should be in. And then we also have a laser that we use that usually is really helpful for inflammatory type conditions. So if you have a lot of inflammation around your ear, your jaw, we use the laser in conjunction with education and hands-on techniques to treat TMJ.